They work around the clock to offer critical care to severely ill patients afflicted by COVID-19. The Intensive Care Unit, a place where some patients get a lifeline. Ghana has so far had 13 severely ill persons requiring intensive care since the country recorded her first case. My name is Akufo-Addo. I have come to the University of Ghana Medical Center ICU not to be offered any life support, but to understand what a day in the life of these critical care workers here looks like. Meet Dr. Christian Owu, National Coordinating Member for Critical and Severely Ill Persons and Head of the University of Ghana Medical Center Intensive Care Unit. Through a network of doctors and health workers from the COVID Connect Service Coordination Hub, we have been granted access into a facility which has nearly become home for many of these staff.
I'm here with Auntie Iram, the DDNS, Iram Efewuku. She is the nurse in charge of the unit, and then Dr. Emainima Adai, one of the doctors working in this unit, and then Dr. Daniel Soti, who is one of the specialists, actually the specialist on duty for the day shift in the intensive care unit. Yeah, so you're welcome to visit our units, and we're going to try to give you an exclusive tour of what the life of critical care staff looks like in a day. We'll do our best to maintain the confidentiality of our patients, so forgive us for that, but we'll try as much as possible to give you a best eye view of what a day in our life here in the context of COVID-19 looks like. You're welcome.
Thank you very much. We are absolutely pleased to meet all of you. So we're here inside the intensive care units building proper, where a lot of action goes on. We'll be understanding all the dynamics in a short time. But Dr. Chris O will tell us briefly what is going to happen in a short time.
One of our senior critical care nurses, Lodina, is actually who is going in at the moment. These are critically ill patients requiring frequent entry into the ICU, and they're requiring continuous monitoring, which we do in our monitoring room all the way through there. So all this she's done is basically she's protected everywhere, making sure that no part of her body is exposed. And this is once used. She's going to use it only single. And then when she finishes, she's going to discard every one of them. And then in another short period of time, somebody else, you can see others are preparing in there, and then they would move in. So Lodina is going to basically continue her work.
Okay. And how often do the patients feed?
All right, so depending on what diets the patients are on, based on their nutritional assessment, some of them may be on continuous feeding through their veins, others may be eating orally, and in which case, based on their nutritional assessment and prescription, it may be 3 times a day like me and you, it may be 4 times, it may be even multiple times with different meals. But all that would have already been decided based on our assessment of the patient, their nutritional assessment, and their requirement for that day. Again, that means that the therapists or nutritionists would sometimes come and also do this assessment and discuss this management with us, that then will prepare this based on that. So our Deputy Director Nursing Service, Mrs. Iram Efewuku, and Auntie Emma, one of our senior nurses, would actually come talk to Lodina. She had gone through what she's supposed to do, but they're going to reiterate all of that again, one by one, on a documented paper, but that paper is not going to go in. So I'm just going to leave them for DDNS to take over now to explain to us what we're going to do, because that's nursing care. That's not my part.
You spoke about you and I feeding 3 times a day. Well, I eat like 5 times a day sometimes. Wow. People say I am a glutton, but that's okay.
You're not sure that's all.
I'm trying. Okay.
As Lordina is going inside, there are some instructions that I have to give to Lordina to do. And Lordina have to give this patient, Mr. L, metformin, to check RBS,